People should be interested in this report because it's about healthcare, and healthcare matters to everybody.
We all think that we really know our own healthcare system, but how well do we really know it?
And in particular, if you work a lot in life sciences and medical devices and service industries related to the healthcare system, it's important really to understand how the whole ecosystem in a healthcare system works.
How do we know how to compare and contrast our own healthcare system with those of other countries? This report does that. So in this report, we're not benchmarking, we're not doing rankings. What we've done is we've looked at different patient journeys.
But we also, in particular, recognise the importance of all the different stakeholders to really make the system work for the patient and ultimately for society as a whole.
What we've looked at is how 6 countries are tackling healthcare, how they're delivering healthcare to their citizens through the lens of what we've termed vital signs. What was surprising was that wide variation within country is probably more significant than between country variation.
Another important surprise was really about how difficult healthcare systems find it to look at the patient as a whole in terms of all his or her diseases.
We don't have enough consistent data across any of our healthcare systems to know how best to treat people.
Every country can demonstrate examples of good practice, but the scaling up of that good practice just isn't happening.
One that particularly struck me is how difficult it is for industry to actually trust the healthcare system and vice versa.
How do you constantly evolve these very complex healthcare systems to meet changing demands? That's an extremely hard thing to do. It's all about culture. There are lots of enablers you need to run a healthcare system.
But it's up to individual countries which enablers they choose to adopt and how fast they choose to move.
But at the end of the day, it's the people. They're the ones that can learn from each other and change things to improve patient outcomes.
It is very much about prevention, and healthcare systems that work with academia, with industry and in partnership with their providers are going to be the successful ones in the future.